Welcome and assalamu alaikum to Let's Talk. I'm Dr. Anita, your hostess for tonight, and I hope you are joining us live. If you want to be part of the show and you think that the topic that we're going to discuss today is of interest to you, or there's anything that you could share with us, then please call us on 01924231083. You can also join the conversation by WhatsApping us, which is very easy. Our number is 07585 835-150. We're live on Sky 752. And today's discussion is very interesting. We thought we might want to touch on a very, very vital topic, which is fertility. Fertility in the South Asian community, in the BAME community, the medical social impact fertility has on a family, on a couple, and the problems, the challenges that a couple can face if they are suffering from infertility, the inability to have children after a certain amount of time of being married. It's very common in our society, and I thought that it's something that might interest many. Today, we have invited Dr. Bushera Choudry. She's Vice Chair, ASDOC 1, Chair for Doctors Worldwide. She's very, very passionate about health, information, empowerment in the BAME community, people from the South Asian community, and she also tries to bust all kinds of health myths and inequalities that we face when it comes to the healthcare system. So welcome to our show, Dr. Bushera.
Thank you so much. Assalamu alaikum, everybody. It's a pleasure to be here.
Dr. Bushera, today while I was sort of thinking about all the questions that I will probably ask you, the first question that did cross my mind was, when should a couple actually worry about their fertility?
Sure, and this is quite a common question. People need to understand how easy it is or how difficult it may be to get pregnant. If you are having regular menstrual cycles, every month the ovaries will release an egg into the womb. And that usually happens every month, so that's 12 times a year. So you need to have an idea that those are the times where you could potentially get pregnant. So we have to try regularly for a number of cycles to try and get successful pregnancy. However, 80% of couples will get pregnant within 1 year of trying. And out of those 20%, over half of them will then get pregnant in the second year. So if you've been trying and regularly having sex for over 12 months, I think that would be the time to maybe start asking some questions. It may not necessarily be a cause of concern, but I think at that time period, it would be a good idea to speak to your doctor and ask some questions about your fertility.
Dr. Bushera, another thing that is very common is that when we talk about problems having children, conception, fertility, infertility, the first thing that crosses our mind is what's wrong with the woman? Is it her fault? Is she to be blamed? Is she unable to conceive? Is she barren? What does medical science tell us about this?
We know that of the couples that are struggling to conceive, approximately 50% of the problems actually lie with the sperm. So it's not necessarily always to do with the woman, and that's a common misconception. If somebody is struggling to conceive, a couple are struggling, that it is often a sort of a blame culture, that it must be something the fault of the woman. But we have to just move away from that and realise that it's actually, a problem that could be affecting the male sperm.
It's very interesting because when we talk about fertility, sometimes it can be a very painful subject for many, and that too because of the social pressures. If the pressure doesn't come from the husband, it is going to come from the wider community, it is going to come from the in-laws, it's going to come from the woman's own family, siblings, parents, cousins. I mean, random people will ask you that question. You've been married for 2 years. Where's that baby? Why are you not conceiving? What's taking so long? Is everything okay? What would you say about that?
I think it can be a very sensitive issue, and you can never assume to know what's going on in someone's married life. And it's very easy for us to assume as soon as somebody is married, they're not having any difficulties. But you know, there can be quite difficulty at first just to being married, just to having a partner, establishing a relationship, and also a sexual relationship. It's not easy for some people to immediately start trying to become pregnant, and we have to address that. In order for someone to be able to be comfortable and intimate with their partner, they need to establish a relationship, and that can take a little bit of time, and that's different for other people. And also, a lot of women experience miscarriage. It is common. However, it is a taboo in our community, and people don't want to talk about it. So I think you have to be sensitive. I think it's better to choose another topic and just ask, how is married life? How are you enjoying moving into a new house or a new town? Avoid that subject unless you're close and understand what that person's going through. And there may be more going on other than, trying for a baby. There may be difficulties in the relationship that could be a problem as well.
So if a couple is experiencing problems and is unable to conceive, say after 2 years of being married, what options do they have?
The first port of call would be to make an appointment with the GP, and the GP will organise some blood tests, checking the female hormones and also checking other factors that can affect fertility, such as your thyroid function, and also checking your diabetes. It would also calculate your BMI, which is your weight to height ratio. So it's important to not be too underweight and also overweight. That can have an effect on fertility. And also, they can do a blood test to check if you are releasing an egg. And also, they would also check for sexually transmitted infections in the female and the male, and do a semen analysis where they look at the quality and the quantity of the sperm. So those would be the initial investigations. And you may also have an ultrasound scan to check the womb and the ovaries to see that they're all physically okay. And that would be the first port of call and the investigations initially before any referral will be generated.
Okay. And if there is a couple and the wife is very eager and keen to get investigated, but the husband is not that keen to come forward and get their tests done, can they still be referred to the fertility clinic, or is it vital for the husband to also be forthcoming?
Yeah, it is very difficult because unless we know what the issue is we won't be able to treat the fertility problem. So we would need to have a good idea. And it doesn't bode well if you need to have treatment. You need to have a good support network, and your husband is vital to be there supporting you and showing that they are equally invested in wanting to have a child, and also be a support for the a partner during the stressful time which it can be.
Bushra, there's someone who's actually asked us a question that we're going to add to the show. So it's a lady who said that me and my husband have been trying for a baby for 4 years. Friends recently had a baby after only trying for 2 months. It is so frustrating and my family are so disappointed. Can you give tips on how to get pregnant?
Of course. I'm so sorry that you've not been able to conceive, and it's something that you clearly want. And I really hope and pray that you are blessed with a baby and you are pregnant soon. And it can be difficult seeing other people have that good news, but I think you have to believe that when it's our time, that it will happen. So some top tips that I think that you could try, which I hope you've already contacted your GP. I think at this stage, after 4 years, I would hope that you have had some consultations. But things that you and your partner can do is make sure that neither of you smoke. If either of you smoke, it can affect the fertility. So even e-cigarettes, we need to make sure there's no smoking. Other things to look at is your weight. If you are overweight, you would need to lose weight, and also maintaining a healthy weight. So if you are underweight, that can also be affecting on your fertility. You need to reduce the amount of caffeine that you intake, so maximum of 1 coffee per day, or a cup of tea, but I would try and reduce your caffeine intake, and limit excessive exercise. So if you are running very long marathons and things like that, you might need to have a think about reducing that. And also maintaining a healthy diet, but also sleeping, making sure that you are getting 7 to 8 hours sleep per night. And so you have the energy to try when you are actively having sex, so you're not too tired to have sex, but also be well rested, so you're feeling your optimal health. You would be advised to start taking folic acid and vitamin D supplements before you start getting pregnant. If you're not taking those, please do start taking those. And if you have certain medical conditions or are overweight, you need a higher dose folic acid. And we know that folic acid reduces the risk of spinal cord defects in the baby. So you need to take it before you get pregnant until you are 12 weeks pregnant. So it's really, really important. Also, you and your partner need to have regular sex every 1 to 3 days, and try and increase that frequency in the 6 days before your ovulation day. That's the highest chance that you can get pregnant if you are having sex and egg and sperm meet in that time period. The quality of the sperm decreases the longer that your partner does not have sex. So that's why it's really important to not just have sex in the few days that you think you are ovulating or pre-ovulation. You need to regularly have sex to maintain the quality of the sperm. And we know that those sperm that manage to fertilize the eggs, they kind of like to be around a little bit before ovulation. Those are the most successful ones. So I think the sperm want to acclimatize to the womb and just get comfortable and ready to swim better if they're acclimatized in the environment. So having sex regularly pre-ovulation is the ideal time. Working out your fertile window is also important, but I wouldn't get too hung up on it. The chances of ovulation are likely to be at that time, but it's not exact. Even if you have a regular cycle, the ovulation date isn't always the same. So that's why you need to have a range of period where you want to be having sex. So 82% of couples will conceive within 1 year, so around 80%. So, it does feel like the odds are against you, but they actually are working towards you. If you have any other medical problems, such as diabetes or underactive thyroid, it's really important that you get really good diabetes control before you get pregnant, and you have adequate thyroxine replacement if you have thyroid problems, because either of those conditions, if they are not managed, they can cause birth defects and also miscarriage. Yeah. So it's really important.
Right. Dr. Bushera, we need to take a break. So let's go to the break. Welcome back to Let's Talk. We were having a lovely, interesting conversation around fertility and the challenges we face if we are failing to conceive. We have lovely Dr. Bushera Choudry on our show, and she was giving us these amazing tips that couples could actually implement in their lives and their lifestyles to make conception much easier. Bushera, we've got another question from one of our viewers, and I was hoping we could include that into our show. So the question is that, I've had myself checked to see if anything is wrong with me. Everything is confirmed fine. Wife is very scared to get tested as she's aware there has been some issue before in her family. How do I persuade her to get checked so we can progress forward? And he also adds that, also on an extra side note, my wife has also been diagnosed with CKD, which is chronic kidney disease, and had a kidney removed recently due to cancer.
Oh, I'm so sorry that your wife's been poorly, and it sounds like that she's been through a lot already, and the issues with the fertility, maybe an added pressure and an added worry. So I'm sorry about all the difficulties that you've been facing. I think it's really important to communicate with your wife. What exactly is she worried about? She's been through a lot, and it may be that she's just not ready yet for some bad news, if there is any bad news. It may just be that she's been through so much, and that's why that you're not able to have a pregnancy just yet, because of the stress that you've both been through with overcoming the cancer and the recent surgery. But I would say that to try and convince her to it may not be the right time. So it may be worth trying to explore when she will be ready. Is she ready to actually undertake a pregnancy? Is she mentally prepared to try and get pregnant? So I think there needs to be some more communication around the reasons why, and it may be that she just needs some time. But I would also, on the flip side, say if she is struggling and she is worried about an issue, the only way that we're going to know if we can help and do something about it is if we identify if there is a problem. But the majority of times when people are not able to conceive, they don't find a reason. So it's not because of any particular problem with the woman or the man. So it just means that it's just not the right time at that time. So it may not be that, and you find a particular reason. So it's not always the case. If your tests are normal, there must be something wrong with your wife, because it's not always the case.
I think that was an excellent answer, Dr. Bushera. And also, it's very important to understand that maybe the wife, as you've rightly said, she's been through so much, and she may be worried that this is going to be another reason. She might think that it's a problem that she has, and that's probably why she's not forthcoming. But then, having said that, if she does speak to her GP, I'm more than certain that once a referral is done to the fertility clinic, investigations can be made. And in today's world, I think it's so much more easy, especially with so many other options that we have. Dr. Bushera, I was going to ask you this particular question, that in the South Asian families, couples, we see that if they want to go for the option of IVF, for instance, it does bring a lot of embarrassment and shame. There's a stigma around it, and they try not to tell anybody about it. What are your thoughts on this particular subject?
I think it's a time that we become really open and help each other, because it shouldn't be a taboo subject. And people do have fertility issues, and we have modern medicine to try and help those issues. So I don't think there's anything taboo or shameful about IVF. It just shows how much you want to have a baby, and you're willing to try everything and put yourself through a rigorous process to have a baby and achieve the goal of increasing your family. So I think we really need to move away from that and talk about it and be open about it. That it's such an amazing treatment that we have available, and we need to talk about it more.
And also, when it comes to couples from the South Asian community in particular, we see that it doesn't just end by having that one child. Sometimes there is a bit more pressure, and there is this expectation that a son is going to be produced. And also, when we look at the cultural aspect of things, somehow when you get married, with marriage, with becoming someone's wife, prestige and respect come directly. I mean, you're just respected more, and that respect is somehow very closely knit to you having children. And when I say children, more so having sons. What do you have to say to this?
It's a very difficult issue, isn't it? Because people have their hopes and aspirations about increasing their family. However, there is absolutely nothing the woman or the man can do to determine the sex of their baby. So it's something that we have no control over. So the fact that we can't control that, it shouldn't be an issue, because it's out of our hands, and it's in our Lord's hands. So I think we really need to just stress that there is nothing that the woman or the man can do to identify the sex of the baby or predetermine the sex of the future pregnancies. It's just not something that is achievable.
Also, I think it's very important to emphasize that a daughter is better, if not equal, to a son. I'm allowed to say this because I'm a daughter myself. I bet you agree with this as well. And I think our elderly parents would agree as well, that the way daughters look after their parents, the way they think about their parents, worry about them in old age, it's astounding, and if you look at numbers, if you look at the next of kins, the carers of elderly parents, it's almost always daughters. So I guess a little bit of awareness around the fact that daughters are actually a blessing, especially in our religion. I mean, we're taught that if you have 3 daughters, then you have your place confirmed in Jannah. How can we not welcome these blessings, these angels?
I think that's absolutely right, Anita, and we need to remind people of that all the time. And we just need to look up to our Holy Prophet Sallallahu Alaihi Wasallam's example, the example of the Sunnah, and how Prophet Sallallahu Alaihi Wasallam treated his daughters, and we all need to just take reference from that.
It's also very unfortunate, and it's something that we have seen here in Birmingham, because we've got a very large South Asian community where women who are on their pregnancy number 4, 5, 6, trying for a baby boy, have been to the anomaly scan, and the sonographer doesn't tell them about the gender of the baby because it's going to cause more distress. Is this something that you have seen in practice as well?
That's true. So a large majority of places do not use a 20-week scan to tell as a rule, they do not tell the sex of the baby, even though they can majority identify the sex of the baby. They do not tell the pregnant women because of this issue that we are sadly still facing. And I have spoken to patients who have had problems with their families when they've had daughters. And it's really, really sad. And if that is something that's affecting you, there are support networks out there. So we really need to be mindful of the fact that this does happen. It is a problem in our communities, and we really need to work hard in changing those attitudes. And that's going to begin with each and every one of us taking that changed attitude to our children, teaching it to our family members, and calling it out. If we ever see it, we must challenge it, because it is so, so wrong.
Dr. Bushera, we've got a question from one of our viewers, and the question is, I have endometriosis. Does this mean that I will struggle to get pregnant?
It could be an issue, but it depends on how severe the endometriosis is, and also you can get treatment for endometriosis. The main thing is to identify the symptoms, and also I get treatment for it. So once it's been identified, because that can often be a long process of actually getting a diagnosis. So if you have the diagnosis, then you already are aware that it may be difficult. So you can take that into consideration when you are trying to conceive. And it would be a conversation with the gynecologist, who would be able to identify how severe the endometriosis is, and if you need to have any treatment before you start trying to become pregnant, because that may help increase and boost your fertility.
Another thing that is very common now, I mean, I get lots of calls, I work in Birmingham, of women calling up and talking about egg freezing, especially if they're in their mid to late 30s, they're still single, and they're worried that they may reach menopause at some stage and not get a partner in a timely fashion. What sort of help can they access? Does the NHS help and fund egg freezing?
As a general rule, no. If it is just for advancing age, then egg freezing would have to be only a private option. If you wanted to have more information about that, there's a Human Fertilisation and Embryology Authority website. It's hfea.gov.uk, and there's lots of information about egg freezing, IVF, and other fertility treatments on there. So I would recommend having a look at that website. But also, with regards to egg freezing, it's only usually an option if somebody's going to be having treatment that would affect their fertility, such as cancer treatment. So they would be offered egg freezing so they can at a later date try and conceive. But on the NHS, it's not available. So it would be a private option only if you are in your 30s. And if you are thinking about it, I would say that you need to start looking into the process quite soon, because as you get older than 35, there's rapid decline in the quality of the eggs and also the number of eggs. So you want to try and do your egg freezing earlier than that, really, ideally, to get the best possible outcome with regards to the number of eggs that are frozen.
Okay, thank you for sharing this with us, Dr. Bushera. This is going to be our last question from you. And this question is with regards to in vitro fertilization, IVF. Now, we do see that the NHS does fund it at times, but unfortunately, it's a bit of a postcode lottery. What can people do who are absolutely desperate and want to go ahead with IVF?
Yeah, it seems really unfair that depending on where you live, you are able to have maybe 2 cycles of IVF, and another area will only offer 1 cycle of IVF, which just seems really unfair. And I think that's something that needs to be addressed. But I think the first port of call would be contact your GP and see what your options are, and ask for the eligibility criteria for IVF. So in the area that I work, if you have already conceived a child, so you or your partner have a child from a previous relationship, then you are not eligible to have IVF on the NHS. But it does vary from location to location. So the best thing to do is speak to your GP and get the details for the local policy about what you are offered, and start the process.
Thank you so much for being part of our show, Dr. Bushera Choudry. It was absolutely amazing to have you on, and thank you for answering all these difficult questions that we've asked you. We're hopefully be inviting you again. Guess it's time for a break. Stay tuned. Stay tuned. Hello, welcome back to Let's Talk. I'm Dr. Anita Raja. And we have just started our second segment of the show. And the second segment of our show is around skin care, skin problems in people of color. If you want to be part of this discussion, it's very easy. You can dial our number 01924231083, or you can WhatsApp us on 07585835150. Our guest for today is very passionate about skin conditions in people of color. He does a very good job in raising awareness around different rashes and conditions in people who are brown or darker colored. And the idea is to break the stigma around this, because when we look at medical books, for instance, you will see that a rash almost always is just shown on white skin. So you have no idea how this rash would present in someone who's colored, someone who has got brown skin or black skin. So it's very important that we sort of break the stigma around this. And I think Dr. Haider Ali, who's a general practitioner with a special interest in dermatology, has done an excellent job on this. So welcome to our show, Dr. Ali.
Thank you. Assalamu alaikum. I hope you're well.
Wa alaikum assalam. We're so pleased to have you on. And my first question is, I know you through social media because you are so good at raising awareness around skin conditions in people of color. Why was this something that you thought was so important?
Thank you. So it's an excellent question. Essentially, it's you alluded to it at the start of your introduction there. We're taught dermatology predominantly on white skin or lighter skin tones. That may well have been as a result of convenience. But this, because of that, because of how we've all been taught on lighter skin tones, we've effectively trained ourselves to be very bad at spotting different conditions that can present very differently on darker skin tones, on black skin tones. And as a result, through personal experience, through seeing colleagues, even when I was a junior, miss things that turned out to be much more serious, it highlighted to me a need for more of a focus on this area of medicine, because ultimately we all want to make sure we don't cause unnecessary suffering through our naivety and lack of knowledge. And that's a nub of it, really, of why I focus so much on skin of color, as they call it in the States.
Thank you for doing this, because I must admit, I learned so much from your page. Every time you upload an image with a different rash, a lesion, it makes it so much easier for me to be able to identify that when I am seeing a patient. So thank you for doing this. Thank you for empowering us general practitioners. My first question is, when it comes to people from the South Asian community, people from the BAME community, unfortunately, almost everyone wants to have lighter skin. And there is a lot on the market when it comes to skin treatments, to skin whitenings. I hear there are injections there as well now. What do you have to say to this?
I mean, you're quite right. You're a fellow GP, so I guess you see a lot of this. Sorry, I presumed you're a GP, but there's a lot of this, unfortunately, and a lot of the skin whitening creams, for example, are actually banned in a lot of countries due to there's not much regulation where you buy it. So as an example, The commonest cream, hydroquinone, is recommended at 2%. But if you go to even Longsight Market, which is a place in Manchester where I work, or near it, you can get 4% without a prescription of, you know, people who have bought it from abroad, from the Middle East or from other Asian countries. And the problem is, it's not that we absolutely need you to come and see the doctor all the time, but with things like this, you can actually cause permanent damage to your skin. You can cause essentially one area of your body being wider than it should do, or cause a skin burn of a, you know, there's lots and lots of these issues. Now, there are lots of conservative treatments you can go through with a GP, and a lot of GPs will have a lot of knowledge about this kind of thing. So a typical practice, for example, will have, let's say, 3 or 4 GPs, each with their own special interest, if you like. Ideally, I happen to be, my practice's GP with a special interest. So my colleagues would refer into me, and it can save time from time and unnecessary harm to patients who can get a lot of aesthetic treatments from from non-medical professionals. And we've seen a lot of this, from Botox to steroid injections, as you alluded to, that don't cause the desired they don't lead to the desired result, shall we say.
But Dr. Ali, don't we need more regulation? I mean, it's shocking that you can actually go out in the market and purchase these items and apply them on your skin. And again, I just fail to comprehend how a non-medical professional is still allowed to inject fillers and Botox. I mean, isn't this shocking?
It's absolutely shocking. I mean, you can imagine, we have regulators, so we wouldn't dream to do something we're not qualified to. I get nervous anytime a patient comes asking for dental treatment, even if it's antibiotics, because we know to stick within our competencies. But when I understand in the aesthetic world, there are rules coming into place in the next 12 to 18 months, if not sooner, to make it very difficult for non-medical people to get hold of these things. Unfortunately, going back even when I was a medical student, about 13 years ago now, there was a common practice where you would pay someone to get you a prescription or a vial. It'd have to be someone who can prescribe, and then you, let's say, hairdresser in this example, who's seen a couple injections, will then go and provide a much cheaper service because you've got the medicine to do it with, which is ludicrous. But it happens a lot. And we see the result of it when someone comes through with sometimes horrific problems where you have to refer them on the NHS to plastic surgeons to try to fix them up, I guess. And that's the problem.
Shocking, yes. That is the problem. Yes, we need more regulation. I wanted to sort of touch on the fact that if you look at the South Asian community, somehow there's a lot of preference given to women, for instance, who are of a lighter skin tone. And it is sort of related to beauty. So if a woman is beautiful, it's automatically assumed that she's going to be someone who's of a lighter skin tone. And I guess that puts a woman through a lot of pressure, especially if she is in her mid to late 20s, she's still single, and she has a darker skin tone because she isn't desirable the way someone of the same age would be if they have a lighter skin tone. Now, how are we supposed to break this stigma if, clinicians, estheticians are still providing lightening treatments instead of saying to a person when they see them, come on, you're beautiful the way you are? I think that's all a person needs to hear. I mean, what are your thoughts about how we can break this cycle?
First of all, I couldn't agree more with you. I think we need to start accepting that we're beautiful the way God made us. We are on British Muslim TV, so I think it's only fair to signpost to our religious leaders, if you're religious, to essentially say that if it's not already done, to put some impetus on maybe talks about, is it right, is it proper that we want to change our bodies drastically? And we're not talking about like obesity and things like that, but if there's nothing inherently wrong with you, should you really need to want to change? And I think a lot of it comes from pressure. So you get shows on TV, as you say, a lot of so-called people that are considered beautiful tend to be portrayed as either supermodels who are Caucasian typically, you know, and I think we need to have it. Essentially, we need to put some responsibility on the media to show more of variety, and you can see that even in dermatology adverts are now focusing not just on the model who's clearly underweight, but they show average normal bodies. With things like L'Oreal, Dove, all these adverts now show people like you and me, who may appear on them, and who might not have a six-pack under their shirt or a washboard or whatever. I think with respect to how we can change in the South Asian community, it's predominantly at a community level. Even within my friend circuit back in med school, I saw lots of my friends when they were at that stage when they were trying to get married. The boys would go for suitors, and their moms or aunties would say, "No, you can't go for her. She's very dark," and the boy would be very dark. Not that it would matter, but as you said, light is right, or that's the perception. From a religious point of view, it's very wrong. From a logical point of view, it makes no sense. It's something that's drilled into a lot of people over a long period of time. And this, I belong to the Arab community, if you like, and it's no different to the South Asian one. They have similar, to generalize, they have similar beliefs or wide-held thoughts. So it has to start at the community level, because if we rely on the media picking up, as it were, and changing, we're going to be a long way from incorporating these positive thoughts of we're beautiful the way we are. And that's why I think essentially. Yeah.
Certainly. And it's just very painful to see that women have to bear the brunt. I mean, as you've rightly said, it doesn't matter how the groom looks. The bride needs to be fair and beautiful. She needs to be perfect. Why? I mean, how do they set that standard? Is it because she's a woman and he's a man? I mean, these are topics that we certainly need to talk about again and again. It's very important that we make women more confident by encouraging them, appreciating them, and not talking about their looks. Telling them how intelligent they are, how smart they are, how funny they are, how their sense of humor is great, how they're so loving and caring and kind, rather than talking about how dark they are or how big they are or how they could do better and be slimmer and have that six-pack and have that 24 waist, or it's just a very irrational. It's something that you cannot achieve, and it's painful, especially on media, when we see all these social media stars who literally had a baby like 6 weeks ago, and again they are pre-baby weight. It's just not possible. And I think that is something that we certainly need to have a look at. And Dr. Heather, you're doing a great job in this, because you're actually spreading a lot of awareness, and you're making it more normal for us to consider skin of color as of some importance as well, because up until now, it's always about the white skin and the rash on the white skin and the disease of the white skin because it's convenient. But you've taken this excellent step where you're actually working on telling people to hold on a second and look at colored skin and lesions on a colored skin as well. Viewers, you have to stick with us. And if you have any questions that you want to ask us, please look at our screen, and you can have our number in WhatsApp group. It's time for a break. Welcome to Let's Talk. I'm Dr. Anita Raja, your hostess for tonight. If you want to be part of our conversation, which is skin conditions in people of color, then you can give us a ring on 01924231083, and our WhatsApp number is 07585835150. We've got Dr. Haider Ali with us, who is a GP with special interest in dermatology. And before we went on our break, we discussed the stigma, the taboo, the difficulties we face if we don't have lighter skin color, the desirability factor, and the way we need to combat all these challenges. Now, coming back to a more medical note, Dr. Ali, I was wondering if you could enlighten us. When it comes to acne, it is a thing that we see all the time in general practice, especially teenagers come to us. And somehow, if you've got darker skin, the scarring can be quite dark, even darker, and it can have a psychological impact on whoever is suffering with acne. So what sort of treatment options do we have?
So first of all, you're quite right. Skin medicine, skin complaints that are poorly treated, especially in people of the BAME community with darker skin tones, if not treated early, can lead to those what we call post-inflammatory hyperpigmentation, which is, in layman terms, is when you get areas that are very dark or darker than even your normal skin tone. And I had the luxury of, when I was training to be a GP, I had about 6 months of being assigned to a group of dermatology consultants. And the thing they drilled home to me really was, encourage your patients, encourage your patients, encourage your patients to come and see you early. Because if I saw Mr. Smith, to make up a name, who had, let's say, even moderate acne, you know, I would start trialing him with maybe an ointment rather than go straight to an antibiotic, and I wouldn't really consider an ointment and a pill to hit it in two different ways, shall we say. Whereas I was recommended with African and South Asian patients in particular to give it a double shot, if you like. So trial them with a good, strong topical treatment, so a cream or an ointment, as well as a tablet, particularly if they've got acne in other places than just the face, in places where they can't really reach well, the back, shall we say, the shoulders or the chest area, and particularly if it's extensive, because as you can imagine, it can be quite cumbersome to cake yourself in a lot of these treatments, and they're often more than once a day. The biggest problem, I would say, is getting young people to come and talk about their skin. So I often find in my clinics, they'll let's say they've come to talk about something different, and I'll say, "Oh, I notice you've got some acne or some spots. Have you ever spoken to anyone about that?" Even if it's not too bad, and then the way I bridge the gap, if you like, because it's already difficult for them to talk about these issues, is I use myself as an example, and I'll say, "Look, I used to suffer with quite bad acne, but I had a very good healthcare professional or family medicine doctor back in Sweden where I grew up. They were very hands-on. So if you were, not keen on talking about those things, they would broach the subject, which is what I try to do, and say, how's life going? Is high school going well if they're at that level? I used to struggle, of all things, with my skin, because now I'm lucky to have relatively good skin. And the person I have to thank really was my GP, because I was never going to talk to the doctor about just my skin, which is what we get a lot these days, because there's so much more, on paper at least, so much more important things going on, including COVID. So we have to almost encourage them to come and see us, which is what I've been doing.
Lovely.
And yourself.
And when do you actually refer them? Because there seems to be this wonder drug on the market, Roaccutane, but it needs to be prescribed by a specialist. So when do you actually decide that, this is the time for us to refer you to the dermatological services?
So it's really interesting. First of all, I think I don't tend to refer to dermatology that often, but what I do, because a lot of the times, and I'm sure a lot of GPs will attest to this, and I might sound like a nightmare GP for people listening, but when you come through, I never say no. I'll say, well, how about I try one or two things? And if they don't work, I promise I'll personally expedite your treatment to the dermatologist, as I know a lot of them, I worked with a lot of them. And my take-home message is essentially, any specialist is going to expect any good family medicine doctor or GP to have trialed one or two of the common treatments. Because if we haven't, the first thing they're likely going to do is tell you, try this, come back 6 weeks later, which we know is going to be longer than that to see them to begin with. And the outcome is that they're probably going to suffer with bad skin for a bit longer than they need to. And if they're unlucky enough to have something like acne, which is for the most part quite readily treatable and manageable, they can avoid a lot of the long-standing things like scarring or darker skin patches that come as a result of scratching or picking at some of the spots we might develop. So to summarize, essentially, I give the patient the options. I tell them why I'm suggesting doing whether it's a topical treatment or a tablet or a combination thereof. And I never say it's a no. I make it as patient-centered as possible, but I give them that information they may not have from Google or from a relative that's had a successful treatment that might not be suitable for them. But I give them enough information for them to make an informed decision, essentially, because that, at the end of the day, is our job, isn't it? And for the most part, it's gone quite well. And those that have needed referrals, the dermatologist has written to both of us to say, you did the right thing to this stage, it's prevented X, Y, and Z, but they need Roaccutane, for example. But and I'm sorry to drone on, but the bit with Roaccutane that's really important is a lot of people don't realize GPs can actually prescribe a liquid version of it, a cream version. So if I've tried 1 or 2 treatments and it's not worked, I'll say, look, we can refer you, but do you want to try Roaccutane as cream? If that doesn't work, you probably do need to see the dermatologist, and we can provide pictures and referrals now and all these kind of things to, again, bridge the gap.
You seem like a dream GP to me, not a nightmare GP. I think you would actually sort the dermatological issues very well. Now, we've got a question, Dr. Ali. There's a viewer who's asking this question. So every sunscreen I have tried gives me a white cast. Can you recommend any that are better for dark skin? And I agree, this is such a vital question, because whenever we, people of color, put the sunscreen on, it does give you that sort of white tinge.
Yeah, I mean, there's actually a lot of new creams that are out there that are combinations with SPF and a moisturizer. A lot of ranges by L'Oreal, I think. I'm more than happy to compile a list for those interested, even if I give it back to British Muslim TV and they can dissipate it to their followers, if you like, or their viewers. And there, you know, there's been a big campaign, and as you say, sometimes we get almost like a shield or a remnant on our skin where you can tell there's something on there that shouldn't be there, and that can be quite off-putting because it comes across as quite a cumbersome, oily, greasy thing to have on.
It certainly is. There is a very good one, which is by Cosmolan. It is a 130 plus SPF, which comes in a tinted version. So it's very good for brown or darker colored people because it sits very well. It's got a bit of a tint in it as well. So I guess, yes, you're absolutely right. And it would be so good if you could sort of compile a list and get back to us so we can put it on our channels on Facebook and Twitter and all sorts. Fine. So there's another thing that we see quite commonly, especially in South Asian women, women from the BAME community, where there is a lot of facial hair, and it really does bother them. Body hair as well, but then with body hair, we see that they sort of manage to get rid of it with waxing and laser treatment and all. But when it comes to facial hair, it can be quite worrisome. And I've seen many young mothers worrying about their very young daughters who are maybe 8 or 9 or 10 years of age, and they're already worrying about them having facial hair, excessive hair. I mean, what can we do about that?
Essentially, it's what we call hirsutism, which is this excess hair growth on the face and other places. But we're always bothered about the face because it's our passport, our first thing to greet people with. First thing is to speak to a medical professional, because there can be a lot of causes for this. Let's say we've established the cause and it's not something readily fixable, which is rare. There are conservative treatments and there's medical treatments, shall we say, and then there's what I call surgical treatments. So very briefly, because I know we're slightly cut for time, there used to be only one hair removal cream back when I studied, which was called eflornithine, that your GP had to prescribe. Is notorious for causing burning or irritation to the skin. There's now a multitude of different creams you can use. You apply it essentially to the problem area, leave it on for a while, and then as you wipe, the hairs come out with it. For those that don't want to do that kind of thing or can't, aren't keen on chemicals on their face or have had reactions to a lot of these creams, I'm sure they've been shaving, or there's people who have been put off and tell me, doctor, I can't shave because it'll make the hair come back thicker. And there's actually no science behind that, because the hair follicle, so that's the base, the inside part of the hair where it's sat in the skin, that doesn't change. So you could, with advice from dermatologists, are essentially to shave more frequently, maybe every 6 weeks, including particularly for waxing. Again, for a lot of my friends, family, they say that doesn't work very well, as well as patients, of course. So there are things like electric hair removers that are quite useful. There's medication that we use for various different things, like spironolactone is one. There's a contraceptive pill. So we need to educate about that as well, because when we give the contraceptive pill, a lot of my patients say, but Dr. Ali, if I use this, I won't be able to have kids in the future, or it'll damage some part of me on the inside. And they swear by some anecdotal evidence. But it's quite the contrary. It can be quite a life changer for them. Then if you can afford it, things like laser therapy, that tend not to be on the NHS, unfortunately, but they work very, very well. What I wouldn't recommend is our friend, the hairstylist or the barber, who have these machines and try to do laser treatments, and they invariably go very wrong. I'd avoid those at all costs. And then, yeah, other things would be to investigate yourself for the hormonal causes, because a lot of patients with cysts on the ovaries, a condition we call polycystic ovarian syndrome, can have this. And I've had a lot of success with giving people metformin, which is a medicine we use, of course, as you know, to help diabetic patients, but also helps patients with polycystic ovaries. Diabetics too can get these problems, which is why that tablet's used. So effectively, the best way to combat it, I'd say, is to know you're not on your own with any of these problems.
Right. Dr. Ali, thank you so much for being part of our show. Viewers, thank you so much for being part of Let's Talk. I'm hopefully going to see you next week again, same time, same channel.